Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I love when Dr. Burton Feinerman comes in for the show because this is such new, cutting-edge information. And Dr. Feinerman is no spring chicken. He's been doing this a long time. And now he's just really feeling so good about it because things are easing up that he can get stem cell treatments done here in the United States more easily. So thank you for coming on our show, Dr.
Always
Feinerman.
A pleasure.
You know, you have brought something here to Palm Beach County, actually to South Florida, that we have lacked before. And I'm really thankful that you found your way here.
Well, sadly enough, I think it's lacking throughout the country. It's just amazing. Our country, as high technology as it is behind the rest of the world. I mean, stem cell treatments, and I'll be talking about, and I have spoken in the past. They're done all over South America, all over Europe, key places in Asia, particularly in Thailand and Singapore, and China, Philippines, and yet the United States still lags behind. But the FDA has opened up the crack a little bit so that we can do some stem cell treatments here in the United States. As long as and the nice part about it is that we're using stem cells from your own body, stem cells that we get from your blood, your fat, or your bone marrow. So it's all completely safe. There's no side effects. There's no problems. There's still this vague mystery that's out there that people say, oh, I don't know about stem cells. I don't know about stem cells. Unfortunately, 98% of doctors in the United States are illiterate when it comes to stem cells.
Well, we don't want our listeners to be illiterate. So let's start off with, go ahead with the basics. And so someone comes to you, let's say they have diabetes. Well, tell me what you do, what you say, and then how it all comes out.
Well, each and every disease, of course, requires a different approach. A different approach meaning what kind of stem cells are we going to use, what method of administration. And then when you're talking about diabetes, you're talking about diabetes type 1, which is usually totally insulin dependent, and type 2 diabetes, which usually is diet, exercise, and oral medications, although some type 2 patients have take insulin. And then there's a third group, are the juvenile diabetics, the who develop diabetes in their early childhood, and now they're adults, but they're very fragile and difficult to control. Some of them end up on insulin pumps, which are awkward and troublesome to have to be tied up, in a sense, to a pump. And now all of a sudden here are stem cells that could totally reverse their care. So let's talk about the type 2. That's relatively simple because we take stem cells from your own bone marrow or fat. We administer also insulin growth factor. It's given intravenously, and that should make a difference. Let's talk about type 1 and the juvenile diabetics. There, you want to be able to use adult pancreatic islet stem cells mixed with the stem cells from your body, the mesenchymal stem cells, and the insulin growth factor. But more important in the type 1 diabetic is we want to deliver those directly to the pancreas, and in doing so, the ideal way is to become partners with a interventional radiologist who can literally pass the catheter safely and without any problems right up towards the blood vessels of the pancreas. And that person is going to either stop having diabetes or have a much milder form of it.
All right, so let me ask you a few questions here. You're so smart, and I know you can keep going on, but I'm going to be the public here. So a stem cell. So you're saying, in essence, you're going and the rest of your body has healthy stem cells, except for maybe the place that you are deficient, like let's say your pancreas. So the healthy stem cell now gets mixed in. What happens to the unhealthy ones? Do they just dissipate?
Well, I mean, there's such an overgrowth of hundreds of millions of new pancreatic stem cells that just like they age and die, the ones that are not functioning. Yeah.
And so now and do you have to be a healthy person for them for you to do this with someone? Let's say that someone has cancer or they have some other disease. Is that separate from the stem cells you're going to be using?
Well, I mean, if we're treating it, we focus on their disease.
Pancreas, let's say it's diabetes.
The diabetes. And if let's say that person has prostate cancer or has just gotten my administration of your autologous mesenchymal stem cells is not going to flare up your cancer in any way.
And it's not going to affect, it's still good stem cells to go directly to the pancreas.
That's correct. Well,
interesting.
Right.
How do they know to do this? How does the stem cells know where to go?
Well,
sorry.
In what I just described, we're helping them. We're putting them right in the pancreas. So there's not any problem about it. There are other conditions, which we can briefly talk about, like the ideal one is like chronic lung disease. And in thinking about that, it was just yesterday that I had lunch with some friends, one of whom was a woman whose children I took care of 55 years ago, all four of them. And she by just pure accident and conversation with some other people, found out that Dr. Feinerman was practicing right up in the Wellington, West Palm Beach area, 5 minutes where she lives. She lived and I practiced in the North Miami area 55 years ago.
Dr. Feinerman really is I guess your specialty many years ago was being a pediatrician.
Yeah, that's correct. And I did that for 40 years. And in the last 12 years, I've been focusing strictly on stem cell and gene therapy. Well, interested in the conversation, and we'll get back to talking about the COB in a second, is that she started, this woman who is now 80 years of age, and she lost her husband just about 6 months ago from COPD, chronic obstructive pulmonary disease, a disease that still is very prevalent in the United States, mostly because of the effects that these people had of heavy and regular smoking throughout their lifetime. Possibly in 1 or 2 generations, we won't see it so much in the United States, at least. But anyway, COPD and emphysema are conditions that respond beautifully to stem cell treatments. And again, we use your own stem cells. Usually we extract it from the adipose fat. And when we give it intravenously, those stem cells, they get caught in what's known as the pulmonary trap, and they migrate 100% to the areas of damage in the lungs. They repair the lungs, and they regenerate hundreds and hundreds of millions of new healthy lung cells.
So Dr. Feinerman, how long from the time that you inject can that person now see healthy lungs?
Well, of course, there's varying degrees based on the age of the patient, how long they've had COPD, whether they're on oxygen, how much oxygen. But usually you can see a significant improvement in their lung function and their oxygen saturation, which is a way of knowing also about their condition, by within 90 days.
Really?
And within 3 to 5 months, that person who's on 2 liters of oxygen or more is probably going to not be on oxygen at all.
Amazing. I want to give everyone your phone number. I know people are listening, and I know that you have a lot of other problems. Maybe it isn't diabetes, and Dr. Dr. Feinerman will go over some of those, for instance, Parkinson's, Alzheimer's, MS. But let me give you some phone numbers for him. Remember, this is Pencil Talk Radio. You want to get those phone numbers because this is your life. And we were talking in the previous half hour about Valentine's Day. And one thing Dr. Mencia said, which is really important, be your own Valentine. This is the way that you can take care of yourself. Love yourself and be around here for much longer and much healthier. The phone number is 561-557-3358. And I'll repeat that. 561-557-3358. And another number is 941-592-6613. Again, that's 941-592-6613. And you can go on the web. You have a lot of websites, but let's give you the one that's, it's called stemcellgeneticmed.com. stemcellgeneticmed.com. And then you'll be able to talk to Dr. Feinerman or his wonderful support system, Dawn. And when you meet Dr. Feinerman, you will know he's very special. He cares, and he's so thrilled with what he's doing with stem cells. He wants to do it on everybody. So we've got to hold him down here. Okay, so Dr. Feinerman, keep going.
I think we should do it on everybody.
Good.
And you, Anita, are the one that sort of steered me into that direction.
Yes,
because,
let's do that.
Instead of waiting until we get some of these horrible, incurable diseases, why not make an effort to, let's say you're in your 40s and 50s, you're in perfect health. Why not take, just like you take your car when it gets over 50,000 miles or whatever it is, and on a regular basis to be checked out, instead of going to, and the doctor's saying, well, you're doing pretty good for your age. Your lab test and your EKG are okay. There's maybe a little something with your kidneys going on, but it's okay for your age. I don't go for that. It's okay for your age. I do believe that normal, healthy people in 40s, 50s, 60s, and 70s and 80s can receive stem cells again from their own body that are increased to hundreds of millions, and it's one age. Particular age, you're doing it to, help your heart. Another time you come in, you're doing it to avoid kidney problems or liver problems or neurological problems. There's a lot of concern and fear in our population about that. Well, now that we're living longer, will we end up with Alzheimer's or some of these terrible diseases? And I do think that this preventive approach should catch on, but why wait for the next 10 or 20 years for the doctors to in the United States to wake up and consider doing that? Start thinking, just like was Dr. Mencia spoke about earlier, about giving yourself a rose on Valentine's Day. Why not give yourself some stem cells at the same point?
Good advice. That's really good advice. So let's go into what you just said. So you can actually be healthy, and if you were healthy and you wanted like a shot of more health, where would you take the stem cells from, and where would you put them?
Well, the simplest places that's where there's no pain, we can isolate stem cells from your blood to get a higher amount of stem cells, which are called the mesenchymal stem cells. And these mesenchymal stem cells will differentiate, meaning that if I put them in your knee, they'll turn into healthy cartilage. If they're placed in your circulation, they'll help to repair your heart, etc. And so the procedure is safe, it's painless, and I'm convinced it's effective. And so that would be the approach when we're talking about preventive care. And I think I spoke about this once before on your show, where My office is in a medical building, so if I go to the left, I get my internist. I go to my right, I get an orthopedic. If I go a little further down the corridor, there's a nephrologist. So I said, well, I think it's time for the nephrologist today. And so, and he did the workup, and he said, well, your kidney function is down about 15%, but it's not so bad. You're 86 years old. What do you expect? I expect you to make it my kidney function 100%, doctor. Well, so unfortunately, he says, well, we'll fix your blood pressure. Oh, my blood pressure is fine. Well, you probably have something wrong with your blood sugar. No, my blood sugar is fine. I said, well, what are you going to do? Well, we just follow you along. We'll check your lab tests, and if you get any worse, we'll put you on dialysis. I say, hey, wait a minute, I don't want to go on dialysis. Oh. I said, I want you to go back to your books, and I'll come back in a week or so, and maybe you can give me a better answer. But the answer is very simple. You take stem cells from your own body, which I did after I found out my kidney function was off 15%. I had the people in my office extract stem cells from me. I did it from my adipose tissue. Even though they said I didn't have any fat, they discovered that I did have fat when they got in there. And again, it was, I don't like needles any more than anyone else, but it was completely safe, painless. And when I repeated my test again, my kidney tests were normal. So there you go.
That's absolutely, I sit here astonished every time you come and you talk about all this and so my question is, why aren't more doctors doing this?
Well, doctors are artists. They practice the art of medicine. They're not really scientists. And they also get themselves into a routine. And what they learned back in medical school, which in some cases could be 10 to 60 years ago, they're still sticking to. And yes, they go to medical meetings, but some of the meetings I go to, and I say to myself, God, this meeting could have taken place 50 years ago. The titles and the subjects that they were talking about. It's important for doctors to be curious, and when they realize the limitations that they have in treating these patients, they should have the zeal and the desire to want to help their ALS patient, their Parkinson patient, their diabetic patient, their kidney patient, etc. And it could really be done very simply, all through stem cells.
Well, one thing that we don't have a date yet, but Dr. Feinerman and I are working on having a seminar, a little symposium that he's going to put on so people will be able to really see him, ask him questions, speak with him, maybe have a couple of other physicians that he decides. But hopefully we'll do something in March, and we are working on that. So, this is such a pleasure for me to have you here with something that's so cutting edge. And I know that you have. It's funny when you said that you were in Florida for so long down in Miami, and now you've come back, and now you're up in Wellington. I guess you like this area.
Oh, well, I really do. I really do.
You lived in Hawaii for a long time, though, didn't you?
Well, there's nothing compared to Hawaii, but I would say that my wife and I really do enjoy living here. The people are just so friendly and hospitable, and they don't mind saying hello to you when you're walking down the street.
Well, you're
or
so friendly too. Yeah. Can we talk a little bit about Hawaii, because you got me very excited when I heard that as a pediatrician. I mean, you were really on the star circuit. I mean, that was really impressive to me. Are you allowed to say some of the people whose children?
Yeah, sure. Well, when I had the largest practice in the state of Florida, I sold it in 1998, and I said to myself, I've lived in Florida now here for 50 or more years now, and why don't I do something different? I'd not just go and practice in some other location why don't I really do something that everyone else dreams about? So I thought, well, what do people dream about, and yet still stay in the United States? And I said, well, I don't want to live around the Grand Canyon in Arizona particularly, and California. Well, there's too many people are out there already, but although I admire and like San Diego, so I decided I'm going to move to Maui, Hawaii, and I literally packed my bags. I didn't know a soul there. I didn't even know really what Maui, Hawaii really was all about, but, and I'm not going to be a pediatrician anymore. I'm going to, do general medicine, which actually was forced upon me because when I went to Kaiser Permanente in Maui, Hawaii, and they said, "Oh, doctor, you've got great credentials. That'll be great for the younger doctors and certainly for the patients. But doctor, you're too old." And that was, that's 18 years ago. They told me that. And, so I said, well, but that was a good thing. It forced me to, and I said, well, I'm no longer a pediatrician. I got training in cosmetic dermatology. And this is 18, 20 years ago when Botox and, fillers and lasers, resurfacing of the skin was really just coming in vogue. And so I got trained in that. And then I became interested in anti-aging. After all, I was told I was very old, so I better start getting into anti-aging. And from there, I got involved with stem cells, and even in Maui, I was there. But as part of making a living, I got involved. Different hotel managers from some of the major hotels over there, the Grand Wailea, the Fairmont Kealani, the Four Seasons, the Prince Hotel, they each came over to my office, and each of them separately, without even knowing it, asked me, would I like to be the doctor for the hotel? And I said, sure. And all of a sudden now I'm the exclusive doctor for all these places. And the phone rings, and, we have an important client here who wants to see you. Turns out it's Oprah Winfrey, who I treated and saw many times. Then some woman calls up, and her last name is Shriver. And she says, I'm Mrs. Shriver. My husband's ill. And I knew that was going to be Governor Arnold Schwarzenegger, and who could have been nicer and kinder and friendlier and can be, who I also saw several other times. Eddie Murphy and his family, Britney Spears. The most interesting of all was I was the doctor for Mike Tyson when he did his training down there, and Larry David from the who created the Steinfeld Field, Michael Dell, who from the computer company and so forth. So each and every day I said, I really should be paying these people. This is fun for me,
Did you learn anything from them?
Well, I learned that they were good and human people and very friendly and cordial. Certainly to me, I never had a negative situation of, do you know who I am kind of a thing. You know who that is. But I know they were all very warm and friendly, and a couple of times invited me to have on a separate occasion to come and have dinner with them at the hotel and stuff like that. So
I have to tell you why. I know that because I know you enough now. You are so sweet and so friendly and so enthusiastic, and whether you're 86 or you're 26, I'm sure you've always been like this, and we feel so privileged to have you down here now to help, especially now in this new field. It's not new for you, but for us, stem cell treatments. Remember, this is not the embryo. And all of those things that unfortunately some people make a big deal about. That's not really what this is. It's taking your own stem cells and replacing them to places that in your body that you need to help. So let me give a phone number again to call Dr. Burton Feinerman, Feinerman. Phone number is 561-557-3358. 561-557-3358. and they're out in Wellington. And let me give you the other number, 941-592-6613. You can reach him immediately. If you wanted to talk to him, that's really a phone that he can handle very quickly. 941-592-6613. And the website is stemcellgeneticmed.com. stemcellgeneticmed.com. Dr. Feinerman, thank you very much. It was a pleasure having you on.
I always enjoy coming.